Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. So Shailen, thanks for joining me on the Inside Edition.
Thank you for having me, Dennis.
You and I have gotten a chance to get to know each other sometime back when you served on the system board as a result of being president of the medical staff.
Yes.
So you've been around Virtua for quite some time.
I have 22 years this past August, believe it or not.
You started doing one thing, and now you are doing what?
I am now the medical director of maternal-fetal medicine and the section chief for perinatology. But I started just as an attending physician at Virtua.
You came here from academic medicine.
I did.
And now that Virtua is an academic health system as a result of our partnership or affiliation with Rowan University, how has that changed things for you?
Truthfully, it gets me back to the thing I love most about academic medicine, that's teaching, both the residents and the students. I really like teaching students because they're just sponges and they want to soak up everything we have to offer them.
Does that present you with more or less of a challenge? So if I'm a patient and I have a physician also teaching at the same time, who gets to benefit the most, the patient or the student?
Actually, I think both, but the patients love it because they get to see me as their physician, also in a teaching capacity, not only teaching the medicine part of things, but the human side of things.
So you're a specialist in maternal-fetal medicine. Is that something that you always knew you wanted to do? When you went to medical school, what were you thinking in terms of areas of specialty?
In my day, you have to rotate every discipline, ophthalmology, family medicine, so on and so forth. And truthfully, there were aspects of all of them that I liked. But the reason I picked OBGYN is because there was aspects of surgery, there was aspects of medicine, and there was aspects of psychology, and doing a little bit of everything appealed to me.
You mentioned psychology. I also know that you have become one of our champions in practicing excellence.
Yes.
Make that connection for me. You as a physician, you as someone that's dealing with patients, as you say, often have some psychological challenges that you want to work through. How does our practicing excellence new strategy sort of help to impact patients?
You know, the best way I can put it is it's made me a student again. If we keep ourselves open to the opportunity to learn from our colleagues, learn from our patients, it keeps us humble, and that allows me to be better tomorrow than I am today. And I think that's something your mother taught you.
She did. She would always say, be better than today. And that was her way of inspiring me to do more and to do better.
I think it requires us to recognize that we're human and we make mistakes. But if we learn from those mistakes and we learn from our patients and we learn from our students for that matter, we can be better tomorrow.
As medical director of our maternal-fetal medicine program, what do you hope to achieve?
You know, it's allowed me to go from an operational role to a more tactical role. I want my legacy to say that I've left maternal-fetal medicine when I retire. I'm not retiring tomorrow. When I retire, that I've left it better than when I found it. And moreover, that I've trained and helped the next generation and I've mentored them to become the best versions of themselves.
So you talk about legacy, you talk about the next generation. What does your family think about what you do on a day-to-day basis and what you've been able to achieve and accomplish?
They're my biggest cheerleaders. And recently I've been really honored, and I, by the way, this was purely his decision, but my youngest son just started medical school at Temple.
Wow.
So it's really fascinating for me to see his journey through his eyes. It reminds me of how blessed I am to be a physician. And it reminds me of how lucky I am that I have two young gentlemen who have been raised well and they're good people, and they inspire me to be a better father.
But you clearly have set a wonderful example for your son to want to follow in your footsteps, or as I say, into the family business. What about your other son? Where is his interest?
My other son wants nothing to do with science. Right now, he's a junior at Wake Forest University, and he's studying economics and political science, and he thinks he wants to be a lawyer.
Having one to follow in your footsteps, I mean, that clearly has to make you proud.
It does. One of his essays talked about seeing me when he was growing up as a physician and the qualities he saw that appealed to him and how he wants to be that kind of doctor.
So obviously a very driven and accomplished family. What do you guys do for fun?
We love to travel, and we make it a point to take a family trip every year. Love to just spend time together. We're foodies. We like to go out to eat.
You kind of joked about not being anywhere close to retirement, but clearly when that day comes, you've sort of mapped out for yourself the things that you want to do. You mind sharing some of those?
Yeah, there's two big things that are on my mind. One is I feel so blessed that I've been given these skills to be a physician, and I feel it's my duty to return that in some charitable way. I'm not a family doc, so I might have to brush up on those skills, but I would love to figure out how to serve an underserved community. No payment involved, whether that be in the United States or international.
I think that is the true definition of being here for good. You know, taking the things that you're passionate about, merging that with your God-given talents and skill, and making someone else's life better.
You're absolutely right. But I have to tell you, I know you didn't ask me this, but I feel very blessed because I'm surrounded by people, whether they're physicians or not, who are like that. For example, my medical assistant, she's literally my right-hand person. I couldn't do what I do without her.
But healthcare, it's a team sport. And I don't think enough people realize that. And so you just mentioned her, but you work with the team, right? Tell me how you sort of manage that to be the most impactful you can be with your patients.
We learn from each other, Dennis. I try to help them be the best versions of themselves that they can. And in turn, they try to help me be the best versions of myself. And it really is a cultural we, not only for our patients, but internally. It makes for a happier work environment. I like the people I work with, and it makes it fun. In medical school, we learn how to listen to the heart. We learn how to listen to the lungs. But in my day, they didn't teach how to listen to the person. We've since incorporated that, fortunately, in medicine. And I'm trying to teach the residents not only the heart and the lungs, but also the person.
As one of our champions of practicing excellence, how do you get other clinicians, such as yourself, that sort of grew up in this industry, not having those skills or not being taught those skills? How are you now able, as one of our champions of practicing excellence, capture their attention and get them to embrace and use some of the tools that we're now advocating for them to use?
I had some folks who were resistant, who thought, I can't learn from this mini video. But I started showing some of these videos at the meetings, and I tried to explain my story. And it's infectious. It creates engagement, and that engagement wants them to want to do more.
Speaking of doing more, my last question, what would your 18-year-old self think about who you have become today?
He would tell me how proud he was of where I've gone and to tell me not to be afraid of the journey.
Excellent advice. So, Shailen, thank you so much
thank you
for joining us on the Inside edition of Here for Good. Once again, another exciting episode of one of our extraordinary colleagues on Here for Good, the Inside edition. Stay tuned for our next one.